I'm going to turn now to our next speaker is Dr. Alan Kaplan. Dr. Kaplan is a family physician with special interest in respiratory medicine, practicing in Aurora, Ontario. He is chair for the Family Physicians Airways Group of Canada. In addition, Dr. Kaplan is the vice president of the Respiratory Effectiveness Group. He's an honorary professor of primary care respiratory medicine of the Observational and Pragmatic Research Institute in Singapore. He's the past chairperson of the respiratory section of the College of Family Physicians of Canada and Senate member of the International Primary Care Respiratory Group. He's a member of the scientific committee of GINA, which is Global Initiative for Asthma. Dr. Kaplan is also the medical director of the LHIN Pulmonary Rehabilitation Clinics and clinical lecturer at the University of Toronto. He's authored over 177 peer-reviewed articles and 140 conference abstracts. And he sums up his experience with this quote, "I'm lucky enough to be married with 4 children and 4 dogs." So thank you, Dr. Kaplan, for being here with us today. I will pass the mic to you.
Thank you, Melanie, and good morning, everyone. I'm coming to you from sunny Ontario here today. And the task I have is to talk about indoor air quality related to asthma, more specifically, what you should know and potentially do about that. Chantel gave me these learning objectives talking about indoor air quality, talking about sick building syndrome, which we'll talk about. How do we fix these issues and review preventions and treatments for asthmatic individuals? My disclosure is I work with a lot of different people, a lot of different companies. I actually think none of these are relevant to today's conversation. So the big picture here for asthma is if you avoid asthma triggers, then you're going to have less inflammation in lungs, which is a central problem for asthma. You're going to have less symptoms, less exacerbations, and potentially even less medications. So I'm hoping that you'll feel then that this is worth the trouble to look at the actual triggers, including indoor quality. So if we avoid trouble, again, I brought along the troubleshooter just to sort of make us smile. But the idea here, again, is let's deal with the etiology of the problem, the underlying problem. So why does indoor air quality matter? Well, it matters because we breathe a lot. We take 20,000 breaths every day. We actually intake about 15 times more air than food or water every day, which is interesting. And most of the time, you don't think about your breathing because there's no problem. We do, however, spend 90% of our time actually indoors, and the indoor air quality can be actually 5 times dirtier than outdoor air quality. So this has been a very neglected part of what we talk about overall. So we really want to talk about indoor air quality. Now, I'm just going to pull some things out of the GINA recommendations. The details really are not important. What's important here is that we recognize that allergens are very important, but GINA, we're a very data-driven organization. In fact, just avoiding allergens itself as a treatment for asthma has not been shown to be particularly effective. However, there are some benefits to single strategy indoor allergen avoidance, which I'll talk about. Things about reducing dampness and mold, and then doing things about avoidance is certainly there. So we want to avoid allergens as much as possible, including indoor air allergens. So what do we do practically about these allergens? Well, it depends a little bit on what you're allergic to. So house dust mite, these little critters are very tiny insects, and they live in your bedding, and they live in your pillow, and it absolutely doesn't matter if you're not allergic to them, but if you're allergic to them and you spend all night breathing them in, you're going to have some issues. So covers for your pillow and mattress can be helpful to decrease the amount you breathe in. They like it being humid. And in the winter, we tend to turn up our humidity because we're all feeling very dry. Try to keep the humidity under 40%. We talk about freeze or fry them. So if you've got a little one who's got stuffed animals on the bedding and so on, periodically make sure that we clean them up. We either wash them in very hot water, or since we live in Canada, put them in some plastic and throw them out in the back porch for a little bit and freeze them. For outdoor allergens that get in the house, then you want to basically close the windows and use air conditioning to filter. That decreases the amount of allergen inserting. For pets, air cleaners have some value. I'll talk about them. They should be brushed to decrease the amount of allergen being released by them. It's actually mostly in their saliva, and hopefully we can get someone to clean them once in a while. Cockroaches are not usually a very large problem in most of Canada, fortunately, partly because our cold weather gets rid of most of them, but getting rid of them could be useful. And down the road, even there's other treatments for allergens, including things like immunotherapy for things like dust mite and some of the outdoor allergens. So that's just practical about allergens. Now, indoor air pollution, we need to actually talk about it as well. So, there's real obvious things. So smoking, both passive and active, is going to be an issue. There's lots of indoor air pollutants that can actually affect this. There's a whole list of different chemicals there that I don't expect you to remember. But we do have to think about the sources. So heating devices, cooking devices, we're using solid biomass fuels, especially again if they're not ventilated and externally flued. So I'm going to come back to that issue many times. So if we can institute something that's non-polluting effective for heating, then that's going to be something that's going to be more effective and have less indoor exposure to these being partially combusted issues. Air filters can make a bit of a difference as well. So overall, the big picture here is use a non-polluting heating and cooking source if you can, and to avoid these pollutants and to vent them outside when best possible. That's our GINA recommendation. So let's get into a tiny little bit of the science about this. There's something called the epithelial barriers. That's right up on the top, and those things with the little fingers there are images of ciliated epithelium. This is the lining of our lungs. And what happens when you get different exposures that damages that lining, breaks the integrity of the next line down, and then leads to exposure to all these inflammatory cells, which then causes inflammatory cascade. But the first thing that's happened is that epithelium is damaged. It can be damaged by infection, it can be damaged by direct exposure, it can be damaged by chemicals, and so on. And that leads to that vicious circle you see down here where exposure leads into inflammation, which then leads to further colonization of other pathogens, affects the microbiota of the lung, and then can lead to a further immune response, which then again affects the epithelial healing, and that leads to that vicious circle that causes the problem. So here's what we want to protect. We want to protect that epithelial barrier inside the lung. Well, as we said, people spend more than 80 to 90% of the time indoors, and we live in Canada. It's cold, and especially with the oil and gas and everything getting more and more expensive, we want to insulate our homes to keep them warm. And that's wonderful because it reduces the drafts in the buildings. Great. So it does save energy. However, it does also decrease air exchange between the indoor and the outdoor. So whatever is inside stays inside, and therefore it keeps the indoor pollutants in and decreases the amount of fresh, clean air in the indoor environment. So yes, insulation is very important, but it does decrease the ability for air to circulate. So here's a question for you. So, what do you think had better indoor air quality? The East, so this is before the wall came down, or just after the wall came down in Germany. So you had a wall in between the East side, which is the communist Germany, and the West side, the democratic Germany. So overall, the predictors of exposure to nitrogen dioxide, as gas and cooking, smoking, heating sources, and so on, right? So people would think that the East side, where they had cooking stoves, wood fireplaces, and so on, would be worse. But in fact, the indoor air quality was actually worse in West Germany because of successive technology. They sealed their homes up well. They kept the indoor air in, and in fact, the air quality was worse in those sealed West Germany homes than the drafty fireplace heated East Germany homes. Just makes that point. All right. So there are European Academy guidelines on this topic, looking at environmental science for allergy and asthma, the recommendations of the impact of indoor air pollutants on the risk of asthma and new onset asthma and asthma-related outcomes. So I'm going to pull some things out of this just to make some points. So what things do we talk about? We want to talk about cleaning and disinfecting products, dampness and mold, pesticides, and volatile organic compounds, which I'll expand upon shortly. These things, as you're exposed to, remember that epithelial barrier, that can have immediate effect, or it can lead to that inflammatory milieu happening and that exposure, and it affects you years later after the exposure. And there's really good evidence showing that wood smoke exposure is associated with childhood respiratory diseases, again, breaching the epithelial barrier. So we may not recognize that it's happening, but it's happening over time. That's all kinds of stuff we put in the air. Even if you like these scented candles, that's still something that's burning that ends up in the environment and in the atmosphere. So if you look at a picture like this, all the different things that can be happening in your home, and it's mind-blowing here, right? So again, I talked already about cooking stove and fireplaces and all the small particles that can be released there. There can be different infections, pollutants, molds, things like that. We talked about house dust mites, which live in your bedding and in your pillows. We blame the poor pets for everything, but the dander is going to be there. It's going to be an issue. Mold gets talked about. We've talked about pests. And then the cleaning chemicals and other things that we use to chemically clean and do things in our house. Asbestos, in the walls is there. Radon, which I'll touch on, and then there's new things that we're starting to learn about. We're understanding about endotoxins. These are other kinds of effects of the infection that are there that are toxins. And microplastics, which could be a whole conversation by itself, is now being known as an issue in our lungs and in the rest of our body. So again, looking at these pollutants, we're looking at organic compounds, which again, I'll talk about chemical cleaning agents, pesticides, mold, all the things we've talked about. Again, damage to the barrier is really important. Affecting the microbiome and immunization is the important thing. Oxidative stress then leads into inflammation, even neurogenic dysfunction. So the nerves that supply everything, they can get dysfunctional, and they can lead to reprogramming, and some things lead to increased risk of cancer. So again, worth the conversation. Let's talk about some of these things. Let's talk about cleaning agents. Well, the residues from detergents, are what happens when we talk about house dust. So the dust is floating around in there and it gets inhaled in daily life. These cleaning agents are breaching that epithelial barrier, even at very low concentrations, and can sensitize the body, causing immunization. Therefore, the evidence is clear that they can elicit new onset asthma and exacerbate asthma in people with pre-existing asthma. Using something once a week and all these things that we use every day, scented things, sprays, perfumes, cosmetic products, hair care products, baby products, disinfecting wipes, all these things used even as simple as once a week, if they're not cleared out well, are going to then potentially lead to issues. Yes, I have dogs here in the background, so I'm exposed to them as well. So I guess the good news is we shouldn't clean. That would seem to be the really good answer here. But there are things we can use. There are scent-free, more natural products, things like baking soda and vinegar, hydrogen peroxide and lemons and so on can do that. But we're going to clean. We should clean. There's a website there on the bottom to look at healthy cleaning if you want to look at that. We can use an air purifier with mixed results. The key thing is ventilate. So just don't have all those things floating around in the air for you to breathe. Use them, but make sure we air out the area so they're not accumulating. The next is going to be dampness. So indoor air exposures of dampness and molds are very common. Usually they range from leaks, condensation, improper insulation. And then when you got that extra humidity, it promotes the growth of microorganisms. I already talked about things like house dust mite, but also molds and fungi and bacteria. Now, when you have fungi, that leads to spores and fungal fragments that can be biologically active and therefore itself cause an issue, or you can have allergic reactions to them. Again, the data, exposure during infancy increases the risk of asthma and rhinitis up to 16 years old, especially for non-allergic disease. And early exposure to this can lead to persistence of asthma through adolescence. So again, you get an idea of what mold looks like. It can be coming and dripping from the walls. That's going to be there. For those of you that have seen this particular TV series called The Last of Us, what happened in this series is there was an invasive mold that took over people and caused zombies. I'm not saying that's going to happen, but again, it makes the point that this is actually a bigger deal than we give it credit for. Now, Government of Canada does have this, and you can look up the Government of Canada website on how to address moisture and mold indoors. I'll touch on this a little bit. What do? You walk through your house and think about it. And again, I think thinking about this is important because if you're not doing well with your asthma or your rhinitis, why is that? You're taking your medicine. So what's the trigger? So look around. Is there signs of excess mold, moisture? Is there discoloration of the floors and walls and windows and fabrics and carpets? Is there wrinkling wallpaper and peeling paint, and so on? Are there like white powdered crystals on the surface of things? Are there obvious leaks in water there? And it doesn't take long for mold to start growing when things are wet. So you have a leak, it's 48 hours. Within 48 hours, the mold is growing. So it's hard to get rid of that. If you can smell mold frequently, that can be an issue. So recognize that can be there. If you can smell it but not see it, it may well be in the wall. So think about that. So have a look around areas of plumbing and things like that where wires come through. Is there any evidence of any damage? It could be water. Again, when you first start up a fan of heating or cooling systems and you smell that moldy smell, then there's probably going to be mold in those pipes as well. They need to be cleaned out. And if that happens, you're looking for exterior causes like broken bricks or cracks or things like that. That happened in our house. We had a huge leak in our basement. We had to dig all that right up to get that done. So it's not an easy thing to deal with. So what again can we do? It's all about ventilation. keeping humidity between 30 and 50%, even probably 40%. Use moisture-resistant materials in areas where it's likely to get wet. So it's not going to soak in. It's going to sit and pool. You can wipe it up. Ensure that you have drainage in place for things like rainwater, snow. Lord knows we don't get much snow in Canada, do we? And New Brunswick gets a lot of snow. Slope things away from the house. That can be an issue there. That can be a significant structural issue. Repair promptly plumbing leaks and dry the moisture promptly, because if things are wet, it's going to come back. If you're still leaking, it's going to come back. And this was interesting in the website. Limit the number of cannabis plants you grow indoors. I'll leave that to you to see if that's a problem for any of you directly. So the cleanup depends on how much mold there is. So you can see here is a small area of mold here. So those can be looked at locally and cleaned up locally. If it comes off easily, it may not be deep. However, still think about what caused that mold in the first place. You've got lots of molds. You need help. This is going to have to be opened up. This is going to have to be cut out, and you need proper precautions. You need help for that. And if it looks like this, you're in big trouble and you're going to get sick. Do not live in a place like this. You need to get some help for that. So there are recognized qualified professionals that the Health Canada talked about. There's a certification for the Institute of Inspection, Cleaning, and Restoration, and or they can have U.S. Occupational Safe and Health Administration certifications. So when you're getting someone to clean up these kind of things, you want someone who's certified that they remove damaged materials and they don't just do things like paint over it. That doesn't work. You've got to cut it out. It's going to be costly because that's damaged, it's wet, there's mold in there. The only way to get rid of mold is to get rid of it, right? They should give you a good plan of how they're going to do this, how they inspected it, how they plan to clean up. And a good company will offer to have you hire a separate company to perform a post-remediation clearance study to ensure the mold is gone. This is a lot of work, a lot of trouble, but this is going to make a big difference to your quality of life and the health of your lungs. So it's needed there. You establish this mold, you've got to deal with it. Now, people talk about air testing for mold as a solution. Really, Health Canada does not recommend this testing. It's not inexpensive and it's not reliable. So this is not the solution for if you think there's mold, just do air testing, because it's going to be into your walls, into your flooring. It has to be established that way. Next is volatile organic compounds. These are carbon-based compounds that basically vaporize on air and they evaporate. So very quickly they evaporate. So they disappear and they're gone into the air. Okay, so they can be solvents and paint and adhesives and furnish polishes and room fresheners and so on. Excuse me. They're obviously higher indoors than they are outdoors, and they induce a lot of airway inflammation, airway obstruction. And again, the evidence is very clear that they're related to asthma symptoms, airway hyperactivity, and decreased lung function. Indoor air quality. Actually, I really like the cartoon there. I found that when I was trying to make this talk, and it's amazing how we are, we use pesticides both outdoor and indoor, and that's a whole other conversation. But indoor pesticides that do get used will also damage the epithelium, again, stimulate receptors, cause inflammation, the whole thing we've talked about. And they're synergistic in their effect with allergy. So it's adding insult to injury kind of thing. You're already allergic, and then you add this other stimulation with chemicals that can make it worse. So there's good data, again, that indoor pesticide use can lead to wheezing in preschoolers and asthma in adolescents. And of course, children are always more vulnerable to all of these chemicals. And that's something we have to think about. So you're seeing, the story here, whether it's VOCs or indoor pesticides, we've got to get rid of it. So overall, as you're looking at the house, you're considering temperature, humidity, ventilation, humidification, insulation, heating and cooling systems, combustion sources, allergens, tobacco, furniture, products for personal care. You're seeing all this has to be looked at. Excuse me, recovering from being shared by my grandchild. So do air cleaners help? The evidence is mixed with that, so I'm very cautious about saying everybody buy an air cleaner. I don't think that's necessarily the answer. They will improve indoor air quality. How much effect that has on lung health is what the question is. They do probably reduce indoor air pollutants and improve outcomes, but again, they're not going to do everything. So just the answer is just put an air cleaner, you're going to solve everything. You need to do a little bit more. There's different types of it. There's carbon air cleaners. And then there's hydroxyl radical generator devices as well. It'd be lovely if we get these into schools, but the cost of that is probably going to make it prohibitive. That's where it probably be somewhat useful. When I looked this up and trying to find data to document that air purifiers work, and this was interesting. It has nothing to do with respiratory disease, but they actually put high efficiency particulate filtration devices in areas, and they looked at people who had hypertension, and it actually dropped their blood pressure by filtering the air. So that response, that immune response that occurs, has effects on the lungs, but also effects on the cardiovascular system. So this is a big deal. Now, the question I usually get is, which company do you recommend? And I can't really tell you a whole lot of answer. However, Asthma Canada that I'm involved with as well just did a seminar in Ontario about this, and this company called Breathe Well that has this Nano X technology was performed, and again they got filters to do that. So again, I can't personally recommend them, but it's one that Asthma Canada does work with. So I'll see there, and there's different ways of doing it. They have a radical generator they do there, and things look like this to make it go away. But so again, this is one company called Breathe Well you could look at if you're investigating air cleaners. The idea of sick building syndrome, right? So this is the Environmental Protection Agency in the United States with a fact sheet about it. And this is how the picture on the left is how you should think about it. Let's delve into this a little bit. So what makes you think about sick building syndrome? Well, when you got people who live in that building who complain about things that just, a whole bunch of things, headaches, this eye, nose, throat irritation, cough, itchy skin, dizziness, nausea, concentrating issues, sensitivity, fatigue, and you don't know why, and there's more than one person complaining, and it gets better when they leave the building, you probably have a problem in that building. Right? So that's sort of the picture there, right? Now, again, what does this happen? It happens because ventilation may be inadequate. It may happen because there's chemical contaminants, indoor and outdoor. It may be because of biologic contaminants, things like the molds, electromagnetic radiation. That's a whole big topic by itself. Lighting, that sort of looks into the whole issue of having proper sunlight exposure, dealing with bad acoustics and poor ergonomics. That's going to be a factor individually. So these are all issues that could cause that. What are the solutions? Get rid of the stuff that's causing the problem. Cut out the mold, deal with the chemicals, and so on. Improve ventilation rates, potentially air cleaning. But then education and communication. What are we going to do here? Is it worthwhile to open some windows? Do we need to have the air cleaners in the room? We have to look at, examine really all parts of the building to see what's going on. Now, I'm going to get into other things as well when it talks about indoor air quality. Let's talk about carbon monoxide detectors. And it's law to have carbon monoxide detectors in your home because they can save your life. Carbon monoxide will occur because of things accumulating, usually things like tobacco, but more importantly, furnaces, space heaters, poorly ventilated garages that leak into the house, and so on and so on. The symptoms are going to be nonspecific initially, a headache and nausea and dizziness, then developing breathlessness to the point you collapse. This can kill you. Important to have carbon monoxide detectors. That's why it's such a fuss. And why? It's because the carbon monoxide displaces the oxygen from the hemoglobin. So your blood no longer can carry and release oxygen, and therefore you get no oxygen delivered to your body, which can lead you to these episodes and can in fact kill people. And that's why the treatment, once we establish putting people in hyperbaric chambers to push the oxygen into their body and displace the carbon monoxide. So use your carbon monoxide detectors, please. If you don't have them, they should be in your house. Change that battery, even though I know it annoys you. Radon, cancer. Now, Melanie's going to give talk on this, and I hadn't realized this when I created the slides. So radon, very quickly, is a nuclear gas, from uranium that gets into the house and so on. And it is a problem across Canada, particularly if you see in Atlantic Canada. It's got one of the highest levels in the country. And I looked up the data that showed that 1 in 4 New Brunswick homes potentially have high radon levels. And Melanie, you can talk more about this when you give your talk. But because of New Brunswick's geology, there's uranium-rich soil here, and it's something that you should all be there. So, radon detectors, and again, I'll leave that to Melanie. So what to do about indoor air quality? You have to think about it, right? You have to maximize what you're doing. We talk a lot about outdoor air quality and allergens and so on, but think about this, especially when you're managing your conditions not doing well or you have these non-specific symptoms. The timing may help you. Your worse indoor versus outdoor, what does that mean? Think about your chemical use. I'm not saying you shouldn't clean. My wife will get mad at me, but we do need to clean in a way that's safe and not leave those chemicals inside to be continued to be inhaled. Remember mold, and I talked about black mold. I'm just talking about regular everyday mold that can cause problems. Air testing is not really a value, and control your asthma. So optimize your treatment of your asthma and your rhinitis. Right, this is the GINA overall. What I really want to talk about here is if you've got asthma, overall, this is how we talk about picturing it. We talk about looking at the symptoms and the comorbidities and make sure you're using your inhaler properly. Treat those modifiable risk factors and things like that we just talked about, non-pharmacologic strategies, and then review all those things. Again, if someone's not controlled, a whole bunch of steps to take in here. Is their diagnosis correct? Are they using their inhaler properly? Think about risk factors such as indoor air quality and so on. So that's why it's so important.
I don't want to rush you, Dr. Kaplan, but if we can wrap up in the
Yep.
next
Yep.
three
It's
minutes.
literally
Okay,
just about over. I talk
super.
smoking cessation
Thanks.
can't be forgotten. I want to point out that there are people who come from other countries and may continue to live like this here, where they cook inside their house and have exposure to those chemicals we talked about. Masking is potentially a value, but maybe not. So overall, what to do, open your windows, take your medication. Airflow is important. Get rid of smoking. Get rid of secondhand smoke. Careful with the amount of chemicals you use. Wash your hands. HEPA filters with a home HVAC system can be useful, especially for pet allergens. And take care of yourself with proper diet, exercise, and sleep. So indoor air quality is a factor for asthma and maintaining control. We talked about all those. And if I leave you with anything, it's about ventilation being important and advocate when you have to. So I'll stop there, Melanie.
And I could listen to you talk all day. This is a super important topic, and thank you so much for this excellent and fully in-depth presentation. And I am going to go in depth on it on radon particularly when my turn comes around. I do want to open up the floor for any questions for Dr. Kaplan. We've had a couple of great compliments on your presentation. Couple of folks that would like to connect with you afterwards, so we'll make sure that we connect your email address with these folks. I will put just a shameless plug for a resource that MB Lung created a couple of years ago, particularly on the cleaning chemicals side of things. We did a deep dive into the literature on exactly what you had talked about damaging and damaging the lungs and exacerbating symptoms, particularly with children being more vulnerable. So we have created recipe cards for DIY cleaning products, which are effective and safe from a respiratory health perspective, and they are free on our website if anybody wants to go there. I think Dusty is dropping that in the chat. A couple of comments again about just a great presentation. We would love to pick your brain a little bit more, particularly on the education department side of things here in New Brunswick. Indoor air quality continues to be a hot button topic that is chronically misunderstood by those that are making the decisions about our indoor air quality. So thank you again, Dr. Kaplan, for the great presentation. We will connect you with those folks that want to connect. And we do need to keep the agenda chugging along. So thank you again, and I'm sure we will cross paths again in the future.
Thanks, Melanie.